Kia ora. All I'm going to say, because Katherine's recorded a beautiful presentation for us, is that we just wanted to open a discussion. So first and foremost, InterRAI is about care planning and sort of needs assessment for an individual and thinking through, everyone's perception of that and how clinicians might use data, how educators might use data, how InterRAI might use data, how researchers might use data. So we'll just get straight into Katherine's presentation, if that's okay.
I really hope that you're all having a good time down in Wellington and sharing lots of knowledge and learning lots of new things. Myself and Hikaka are presenting this today on behalf of our wider team. And you'll see from our abstract that really what we want to do in today's session is to stimulate some discussion amongst those of you that are listening in terms of how you do or don't use InterRAI data in a clinical setting. We are hoping that this will help inform a survey that we want to develop in the near future with regards to viewing how we can improve InterRAI use at both at an individual, facility and organisational levels. So as we state in our abstract, and as I'm sure everybody in the room listening will be more than aware that InterRAI is required for publicly funded residential care and home support systems in Aotearoa. We have over 1.2 million assessments completed to date, but despite that quite extensive amount of data that's been collected, and despite being extensively used in a research setting in New Zealand, anecdotally, it's, and certainly through my own experience and from some of the data that I'll share with some of my colleagues, it's not really being utilised well in the clinical setting. So we wanted to explore some of the issues really at play so we can consider how better to use this data across the board in the future. So first up, I'm just going to discuss a little bit about my own background and relationship with InterRAI and how I got to know InterRAI. And then I'm actually going to share some of the comments from some other clinicians that I work with across the Auckland and Waikato region. So as I mentioned, I am a senior lecturer at the Department of Medicine and at the University of Auckland, and I practice as a geriatrician at Te Whatu Ora Waitemata. And I've had those roles for some years now. Through my university role, I've been involved over recent years in a fairly large research study, our retirement village study, and that has utilised InterRAI data. However, prior to starting that specific study, despite working as a geriatrician for a good few years, I was only quite vaguely aware of InterRAI. I really had no idea about the specific data that was collected and very vague and little information about the kind of outcomes that could be generated from that data. But during my work on the Villages project, we worked alongside two absolutely fantastic gerontology nurse specialists who are both total advocates for InterRAI. And I learned a lot working alongside them. And I learned much more about the clinical outcomes, scales that were generated from InterRAI data and that we were actually using to inform our research intervention. But with that new knowledge, as I was learning about InterRAI, I was also becoming increasingly curious about how, with my clinical hat on, I've never actually ever received a referral, been asked to see somebody clinically based on an InterRAI based trigger or an outcome scale. And I was thinking, is this just something specific to Waitemata? Is it something about our region that's different to other regions? Or is this information that GPs are getting? Or what's going on here? Because we could see through our research in the Villages study that there were lots of people who were generating lots of outcome data indicating some unmet needs, but that wasn't reflected in the practice of myself. So what I then, that's basically my experience and conversations I've had with other people who have worked clinically within our Villages project has generated us wanting to explore this in a little bit more detail and see what's happening nationally and in other regions. So what I wanted what I did from here is I had a very small series of questions and I put those to a very small number of geriatricians. As you'll all be more than aware, the health system at the moment is really under the pump. So I wanted to specifically target people that I knew and knew well and knew would respond to me. So it's a very small and very biased sample. I've asked 4 geriatricians. They've worked across Waikato, counties, Auckland and Waitemata. They're all very experienced. They've been geriatricians for over 10 years, and they've all had different levels of clinical leadership positions over those years as well. I additionally asked a couple of advanced trainees that I've been working with closely over more recent times Advanced trainees are our senior registrars who are training in geriatric medicine. As I wanted to see whether they were familiar at all with InterRAI. So the first question really was, do you know who gets an InterRAI assessment? And you can see here from the responses, well, I haven't specifically put them actually for the geriatricians, but across the board, they were reasonably aware that those who are requiring community supports in the community or residential care would require an InterRAI assessment. But there was this comment here from one of my colleagues. I assume residential facility gets a copy. No idea if the GP gets a copy. A copy is presumably uploaded into our electronic records somewhere, but clearly this person didn't know where they were. Our advanced trainees were less sure, but one of them had a good idea, but the second advanced trainee really admitted that they didn't really know who gets an InterRAI assessment. I then asked, do you know about the different InterRAI tools that are available? And here I think you'll see that the responses from the geriatricians indicated some knowledge in terms of tools, but also you can see that there is a lot of uncertainty in their response, and one was not even aware that there's more than one generic InterRAI tool. Again, when you look at the advanced trainee responses, greater uncertainty there as well, with one advanced trainee thinking that only those people who are moving between area health boards would be the people that would be having an InterRAI assessment. So quite a lack of knowledge there. So I then asked the geriatricians whether they knew anything about the different clinical scales or outcomes that are generated from an InterRAI assessment. And superficially, they had some awareness that there were scores, but not really great details of them. So one admitted vaguely only, another geriatrician put they were aware of CHESS and DIVERT. Another was aware that there were a variety of different tools or outcomes, should I say, that can be generated across different measures of function. However, had commented that they didn't know what those scales were, and her further comment was, unclear of whether they were the same kind of tools that we would use in a clinical setting, which they essentially are not really tools that we would use when we clinically assess people. And again, somebody else has commented that they know that they exist, but have not found them personally useful to their own clinical practice. As many of you will be aware, those of you that work within health, our electronic health data is now quite extensive, particularly in secondary care where I work. I can't comment quite so much on primary care, but if I have an individual's NHI, then I can see all local clinic letters in secondary care, regional discharge summaries, prescriptions, lab results, radiology, referrals made to public services. I can look at the notes from the community team who might have phoned somebody up yesterday. So if a physio phoned somebody, I can look and see what the discussion was that they had. I can look at somebody's inpatient notes electronically if they were admitted last year, and I can search up what the physiotherapist assessed them for. So it's quite extensive. It's quite easy to find a lot of that data, and included in our electronic system is momentum and access to InterRAI, but I wanted to know whether my colleagues across different sites knew where to find that. So one of the geriatricians commented, I know where they are, but I have never looked. Someone tried to show me one and there was too much information and I felt quite overwhelmed. Another geriatrician put no and no, so they don't personally know where they are or use them, but comment that within the community team that she works with, they do look them up, and she will talk a little bit more about that in other comments. Another geriatrician put, I only know that there is a summary that's the needs assessment team put in terms of assessment for residential care. I don't know where the full InterRAI assessment is, and I've never looked it up. Well, you can't look it up if you don't know where it is, right? So the NASC assessment is very much a summarised series of comments about an individual's need and how that's going to be provided, but it certainly does not talk about any psychosocial symptoms, falls, risks, cognitive alerts, or anything like that. And down at the bottom, we have a comment from one of our Waikato physicians. You'll see that Waikato, and most of you will know that Waikato has a longer history with InterRAI than other regions. And so this geriatrician is putting that they actually frequently do use that data. In particular, this geriatrician works amongst on the orthogeriatrics wards, and they're using that when they have a hip fracture patient to get some baseline functional data and weights and things like that to help inform what the baseline function is for their patients. I'm not quite sure what she means by these latter sentences, to be honest, these latter comments. I'm wondering if you cannot see the InterRAI data for somebody outside of your area, and I think we can at Waitemata, but perhaps that's a different system at Waikato. So overall, a bit of a mix in terms of the usefulness, but most are not using InterRAI data, don't know where it is, and certainly we will see that there are some barriers that are identified to its use, other than where you actually find the data itself. So again, I asked the advanced trainees the same question, and they didn't know. They didn't know at all. I then asked, does an InterRAI assessment impact on your clinical work? And the responses here are a bit mixed. Again, there is reference to looking up these needs assessment summaries of level of care, but again, this is not explicit or specific InterRAI data, but the result of an InterRAI assessment, very much summarized and very much just really around functional needs. There's discussion here, so this geriatrician doesn't feel it impacts on their clinical care. This second geriatrician is again one working within the community team, and so the nurses working on that team as well do access long-term care assessments and utilize those. This third geriatrician here, I was actually looking for positive things that in terms of impacting on clinical use, but this geriatrician here is commenting about how actually it slows things down because waiting.
Okay, well, we might just switch. Okay, feedback's gone. Can everyone online hear me? The presenter looks like it's muted, so I just want to check. Yes, okay, great. So Katherine is online, I believe, so might want to sum up. But basically, we're just, I guess, really keen to open up a discussion about this, seeing the opportunity to utilise the wealth of information that is available in InterRAI, and think through the ways that we can use that. And it feeds into work that Katherine and the rest of the team are doing around understanding perceptions and experiences of use more, and also work that Nari and I are doing around trying to create usable reports for clinicians, but also people that are actually being assessed. So what do they want to know? What, as a summary, what's useful for them to know, and how do we make that strengths-based? So what are you doing really well? What are these key areas of success for you? And where could we help if you need that? So Katherine, are you there? I know Katherine's had an extremely busy clinical load today. Okay, no, that's cool. I might open the floor for questions, comments. Nigel, have you got your little...
Hi, it's Nigel Miller here. Look, this is great. I'm feeling very positive. I'm also reliving my post-traumatic stress disorder because Nari will remember in the beginning, this was very contentious. It was. And there were some interactions with my former, now retired colleagues, which I wouldn't want to go through again. But I'm delighted there's interest. Now, this is actually a health informatics problem, okay? Because we talk about health informatics and data and we get confused. So I'm going to say something very simple here, that you don't want to give people data. And that's what people are saying. I don't want data, I want information. Now, one set of data can give you almost infinite sets of information, particularly a data set as large for an individual as for InterRAI. So what information do you need? That is the question. And I'm glad that that question's been asked, because both at locally at the InterRAI Leadership Advisory Board and now internationally, that question is on the table. How do we take this data and create information that supports clinical care in multiple environments? Okay, because I would like the ambulance crew that comes to see me at home in 5 years' time to know about me.
Is there a question?
Yeah, okay, there's a question. Okay. You did say comments. I'll stop there and just say this is great. And do you want to explore it further, more formally? What information is necessary?
So that's what we're doing. So we've got a sort of a 2-year small project grant, Nairi and I and a team. It includes HINS, so Health Informatics NZ. It includes GABES, and so InterRAI, and we're wanting anyone that's interested in being either kept informed or as part of working groups look through what draft reports might look like. So, you know, what a facility might want might be different to what a geriatrician might want. It might be different to what primary care clinicians want. And so that's what we're wanting to do at the moment. And then actually develop some draft reports with people that know way more about computer things than me. And we might be, online. Yeah.
So question from Natasha online. I have a question about improving patient knowledge and also whānau awareness, as it seems whānau play an important role in advocating for older people to have InterRAI assessments done.
Yeah, no, absolutely. And I think that's the thing. And I think it's what Nigel was talking about. How do you want to use this information? So if these things flag, what resources could we connect whānau and the people themselves into based on different things? And Michael might have a comment there. And Michael's part of the team here that put this together. So
Michael's comment is, one of the main problems in aged care is the time it takes to do a complete InterRAI.
Yeah, it's Michael Boyd here. Look, they do it every 6 months. In aged care, as Julie presented this morning, people change daily. So the complexity of number one, the 50 hours it takes to learn how to do the tool, and also the reassessments that occur every 6 months. I would question whether that is useful data, frankly.
So Michael, I'm interested in whether you in your clinical role in aged care use the InterRAI data for individuals or at a facility level. And that's my last question, because I'm going to make us go over time.
Yeah, look, I was doing a round this morning, just like Katherine, and I asked my lovely clinical nurse leader, who is excellent. We discussed this morning. I never see any of the data as a primary healthcare provider in aged care, and I do it 5 days a week.
Okay, that's really interesting. Thank you very much.